Venous thromboembolism, or VTE for short, is a leading cause of death worldwide. In the Western world, someone develops a VTE every 16 seconds. Manifestations of the disease are deep vein thrombosis and pulmonary embolism. The disease process starts, often in one of the large veins of the leg, with the formation of a blood clot. This can be due to vessel wall injuries, a pathological increase in the coagulability of the blood, or circulation deficits such as venous stasis. The resulting blood clot consists mostly of red blood cells, held loosely together by strands of fibrin. There is a considerable risk of such a fragile clot or parts of it breaking away and traveling with the bloodstream through the heart and into the lungs. Here, the clot or fragment of clot eventually blocks a pulmonary artery. The consequence, pulmonary embolism. The affected area of the lung is no longer available for the oxygenation of blood. This life-threatening outcome can be traced back to an inappropriately triggered physiological process, blood coagulation. Various medical conditions are associated with disrupted blood coagulation and therefore an increased risk of VTE. For instance, immobilization heightens the risk of hypercoagulability of the blood and venous stasis. Patients undergoing major orthopedic surgery, such as total hip or knee replacement, have an additional risk of vascular injury.
Thank you very much for the question. Patients with 6 months to live have 6 months to live. They still have their life, and many patients are still of good performance status in those 6 months. If we look upon treating thrombosis as number one as a symptom control measure, we're actually treating the breathlessness of a pulmonary embolus, we're treating the pain in the leg of the deep vein thrombosis. So we're actually using it as a symptom control measure. The secondary benefit is that you are preventing a premature death. Palliative care, and in the definition, palliative care seeks neither to prolong nor hasten death. But when you talk to the patients, they would opt to be treated because the symptoms they're having from the deep vein thrombosis or pulmonary embolus is distressing. I think if we are looking at people who are what we would call actively dying, so they are taken to their bed, they are not taking oral medicines, they are in and out of consciousness, I think in that situation it is less appropriate. But if we have felt a patient is worth investigating for a DVT or PE, so we have put them through the investigation, we should only be doing that if we are considering treating them. So I think a 6-month life expectancy for many patients is still a lot of time and they have things to do. The evidence that informs these studies were not done in patients with a prognosis of less than 3 months, but certainly 6 to 3, many patients were there in the studies. And from our experience, we've looked at several hundred palliative care patients in hospices who will have lived for several months on the treatment and have been glad they had it. Thank you.
Heart disease. It's projected that 1 out of every 4 people in the United States will die from it. And more younger people are being diagnosed every day. We find out more in today's Health Matters. Age is only a number. That's how the old saying goes, and when it comes to heart disease, that's a fact.
You know, this past month saw individual 27 with cardiovascular pain and blockage, and we see it in 90-year-olds.
As a cardiologist, Dr. Edward Palank warns heart disease can strike anyone at any stage of life, no matter how active they are.
Just because I'm 40 and I'm playing tennis and I'm active doesn't mean I can't have a cardiovascular problem.
While heart disease is often thought of as an older person's problem, Dr. Palank says young people need to be especially on guard.
There's a lot of denial. Not going to happen to me. People are still smoking. You know, we're seeing the incidence in women of a higher incidence of heart disease in women. And we also know there's a higher incidence over the past 20 years of women smoking, starting younger, longer periods of time.
Smoking is one of the leading causes of heart disease, followed by obesity, high blood pressure, and diabetes. He warns everyone, especially younger adults, to take a long, hard look at their lifestyle habits.
You know, they say, well, you know, I know I need to lose weight, but they don't. I know I need to walk, but they don't. So intellectually, they understand, they know what to do, but then they don't do it.
Since heart disease is also genetic, a one-on-one discussion with your primary care physician is also recommended.
Yeah, and if you have questions, that's what your physician's for.
Stress can also play a significant role in heart disease. Your doctor can recommend strategies to reduce your stress. Reporting for Lee Memorial Health System, I'm John Bafar.